been for the last 201 days?
Well, it's very nice to hear your voice again, Piers, Susanna. Well, last week you asked me to, I was on actually, albeit briefly, and you asked me to come back as soon as diaries would allow, and here I am. So very happy to answer any questions.
Do you think it's right and proper that in the biggest health crisis this country's faced for 100 years, that you as Health Secretary and the entire Cabinet and the Prime Minister have boycotted a big morning breakfast television programme and our viewers for 6 months? Do you support the boycott? Did you agree with it?
Well, I'm here to answer all of the questions that you might have on behalf of your viewers.
I just asked you one.
I was. Yeah, and I was, as I say, I was asked last week to come on, and I said that I'd come on as soon as I could, and here I am.
So no, I mean, literally, I've just asked you a question which you didn't answer.
Did you support the boycott?
I'm just curious, did you support the boycott? It's an important question. Our viewers are curious why you've all been away for 6 months from giving us updated information. What is the explanation?
Well, we haven't been away. I've been on, working incredibly hard. For instance, building the sort of testing capacity that we're talking about today, expanding the number of tests that are available. Making progress on the vaccine, which is really good, and we've got more good news about another vaccine going into trials today. And so that's what I've been working on. And obviously, this is a critical period in the crisis. So that's what I've been working on, and I'm ready to answer any questions that you might have.
Well, let me just go through some of the stuff that we missed in the last 6 months, because you are the Health Secretary. It's on your watch. Throughout this pandemic, you started in January, when it first blew up in Wuhan, by saying this in Parliament.
The Chief Medical Officer has revised the risk to the UK population from very low to low, and has concluded that while there is an increased likelihood that cases may arise in this country, we are well prepared and well equipped to deal with them. The UK is one of the first countries to have developed a world-leading test for the new coronavirus. The NHS is ready to respond appropriately to any cases that emerge. Clinicians, both in primary and secondary care, have already received advice covering initial detection and investigation of possible cases, infection prevention and control, and clinical diagnostics. And the public can be assured that the whole of the UK is always well prepared for these types of outbreaks, and will remain vigilant and keep our response under constant review in the light of emerging scientific evidence.
Well, that was very reassuring when you said all that. It then turned out we had very little personal protective equipment for our health workers, so hundreds of them died, as did care workers. It then turned out that care homes, far from having the ring of protection, which you've been boasting about ever since, we actually sent thousands of elderly people out of hospitals back into care homes without testing them for COVID, so a new epidemic was started in care homes. We let, unlike many countries, 20 million people fly into this country during the first wave, many from corona-ravaged countries. You said that the public didn't need to wear masks. Now you say they do. You said it was fine to shake hands at a time the World Health Organization was warning against shaking hands. You said mass gatherings were fine, which is why the Cheltenham Festival went ahead, and Liverpool football matches and pop concerts, and we now know that was a catastrophe. The lockdown was at least 2 weeks too late, and because it was, they reckon 25,000 lives were probably lost. On testing, we stopped community testing at a crucial time because we were pursuing, according to Sir Patrick Vallance and Dominic Cummings, a policy of herd immunity, which we then screechingly reversed. On the world-class testing system which you promised us in January, it is still a complete shambles. So I put it to you, given that we now have over 50,000 deaths in this country, which is the worst death toll in the whole of Europe, why are you still Health Secretary, and why haven't you offered your resignation?
Well, because we've been building the response to all of these enormous challenges of this unprecedented pandemic. I mean, I just pick out a few of that long list. The first thing is on testing. We've hit each of the targets that I've set, 500,000 tests a day capacity now, and I'm here to tell you that we're going to double that over the next few months. And that means that we can use testing in order to find where the virus is. And crucially, we've got those turnaround times down so that people can get the result back fast.
How many people are you testing a day?
And then can isolate if needed. Sorry?
How many people have you been testing each day? Give me the figures for the last week.
So the number for the last week is just over 1.5 million. The number of tests done yesterday was the highest ever, 379,900. And so we are, and that's the highest it's been. But I won't rest with that. We're still driving it upwards. So what I've been doing over the past 6 months,
if you don't mind me jumping in, why don't we see every day the number of people being tested, not the number of tests being conducted, because we know that many people have numerous tests, or the capacity, which is sort of meaningless, because if people aren't being tested, the capacity doesn't really matter. Why are we not getting that daily figure? And here's why I ask, because you celebrated at the end of April the fact that you would hit your target of 100,000 tests a day. The problem was that wasn't the target that was promised by Downing Street. Here is a tweet from April the 4th, where Boris Johnson, number 10, their official account, and it's still there, this tweet, said this, that 100,000 people a day would be tested by the end of April. Are you prepared to admit now, for the first time, that we did not hit the target of 100,000 people a day being tested by the end of April? It was, in fact, the number of tests conducted.
No, because the target was set to have 100,000 tests a day, and we delivered against that. And then we set another goal.
I just read you the tweet from Downing Street, Health Secretary. It said people, not tests.
I know the goal that I think that what people watching this will care about is the impact on people's lives and what we can do in the future. And firstly, the goal back then I set, and I personally set it, standing at the podium in number 10, was that we would have 100,000 tests a day. We met that target. And then we set the goal of 500,000 capacity, because it's the capacity that really matters, because that's how many tests you can get through the system if you need to. And we hit that target. But what matters more than all of this is that throughout this whole period that you've just been talking about, we've been constantly learning and watching and being vigilant about how we can improve the response. It hasn't been easy.
Failing Health Secretary. I say this with respect to you. Look, I say this respectfully. I don't underappreciate how difficult a job this is. But I also know it's what you signed up for. We have had a constant series of failures and U-turns throughout this year. I mean, are you prepared to admit to any mistakes of the charge sheet I read out?
Sure, of course, we've made mistakes, absolutely. I'll give you one. That really matters is that when we first put out the guidance, for instance, for funerals in the first peak, it was interpreted as being so tight that even your spouse couldn't go to the funeral of somebody who died with coronavirus. Now, that was wrong, and we changed it. So absolutely, we've been learning.
We've been learning about the science. Just one point on the borders. Why did we keep our borders open when it seemed like utter lunacy to everybody outside of government? When countries like Taiwan shut down their borders, when New Zealand shut down their borders, when islands shut down their borders, we could have done that. But we let 20 million people fly in. And that may well be, in the end, why we've got the worst death toll in Europe. Why did we not do more at our border?
Well, we have brought in the strict controls that we now have, which mean that we can have the quarantine for countries that are high risk.
Health Secretary.
And then for some countries...
Health Secretary.
Sorry?
6 months later. Why didn't we do it at the time?
Well, we have absolutely brought it in. And one of the problems with the disease that we only learnt about halfway through this the period that you're talking about back then in the spring, is that the disease passes on asymptomatically. And so whereas most coronaviruses, the previous coronaviruses, passed on only when people had symptoms. And that has a big implication, because instead of just watching out for people who have symptoms, we need to be careful, because every single person could be passing it on if they have, even if they don't have symptoms. And so we brought in the quarantine at the border. In fact, in just the last couple of weeks, we brought in an even stricter rule for travellers from Denmark because of the high risk there.
Okay. Matt Hancock, I would like to ask you about care homes. You have already brought up the fact that you made a terrible mistake over funerals. I mean, it was inhumane, the situation where family members couldn't attend funerals. It is currently an inhumane situation in our care homes, where we have people towards the end of their lives currently suffering chronic loneliness because they cannot even see family members. You made a terrible error early on in care homes by sending people from hospital into care homes who hadn't been properly tested for COVID. And we know that that led to a spread of the disease. You surely would admit that was a massive error.
Well, you raised two incredibly difficult challenges from this virus, and the challenge in care homes, and honestly, my heart goes out to people who are in this situation, and I totally understand where they are. You mentioned the two problems. The one is keeping people safe from coronavirus in care homes is so important, and at the same time, making sure that people in care homes can see others, can have visitors. I want to see that as well.
Okay,
and
but the problem, just to put to you first,
balancing the
first
two
problem
is the
was
challenge.
that you didn't test. You did not test people leaving hospital going into care homes for COVID.
Well, this comes back to the point I was making earlier about asymptomatic transmission, because the advice was that there wouldn't be asymptomatic transmission. And now that we know, when we discovered that can happen, we brought in the rules for care homes. And now, the problem now, for viewers watching this programme this morning, the challenge is, how do we both keep people safe from coronavirus in care homes, and how do we allow them to see visitors? And the answer to this is the expansion of testing
Absolutely
that we've also been talking about.
You have launched a pilot scheme today. Yes, absolutely right. You have launched a pilot scheme today. It covers 20 care homes. Out of thousands of care homes, it covers 20 care homes. We know testing is the way through. You've just admitted it. Why don't you just roll out testing to every single care home? There are families who will not get to see their loved ones before Christmas unless you roll out testing, you check that they are negative, that they're not going to pass on COVID, and you let them see their loved one face to face.
Yes, Susanna, I wouldn't say I've just admitted that testing is the answer. I just explained that testing is the answer. I feel so strongly about this, that the testing capacity we have isn't just some abstract thing. It means that people can see their loved ones.
So why don't you roll it out to every care home for every family?
That's what we're going to do, and I hope to have that done by Christmas. But the reason we're doing this carefully is because we have to protect people in care homes as well. So we're doing the pilot to understand what the rules should be around the use of testing, how we can do it safely, and then we will roll it out over the next few weeks. But I'd rather take a couple of weeks now to get those protocols right, so that we know exactly how to do it, so that we don't have this choice between keeping people safe from coronavirus on the one hand.
I suggest you talk to Adam Purnell, who is a care home manager up in Lancashire, who has been running this for 6 weeks. He could tell you everything you need to know about the protocol. They haven't had an infection since they introduced care home testing for families, and you could roll it out today.
Yeah, so I know that some care homes have been doing this brilliantly, and we've been giving more tests to local directors of public health so that they can trial this sort of thing. What I want to see, though, Susanna, is this available everywhere.
So do
and
we.
Hence,
That's what families want, and they don't understand the delay.
There isn't a delay. It's about how to do it safely in all 16,000 odd care homes that there are, which is a very large number, and making sure that we can do it in all different settings. It's so important, and we've got to get it right.
Okay, let me ask you this,
Also,
Health Secretary.
rightly lambast me, if we had more cases in care homes than we need to, and this is the way through, but we've got to get it right.
We look forward to you getting that right. Let me ask you about parking at hospitals. Astonishingly, after all, we debated this back in the first phase of this pandemic, and then the government did the right thing eventually and waived parking fees for nurses, for doctors, consultants and porters and so on at hospitals. It's now back, not just at the levels they were before, but they're planning to have massive spikes so that nurses end up paying over £1,000 in many cases for the right to park outside hospitals where they are risking their lives to save other people's lives. How can that possibly be justified? Why is it that Scotland and Wales have no parking fees for health workers, but England does? Last time we talked about this, you said you would look into it. You've had 6 months. What are you going to do about it?
Well, we don't have parking charges in English hospitals, and we're not going to for the course of this pandemic. That's the case. In fact, I've been in touch overnight with the hospital in question, and they don't have staff parking charges now. That's the policy.
We're going to bring them in on December the 1st, as you know. I've seen the letter. They were advising to bring it on December the 1st. They've now done a U-turn on that. But the real question is, at the end of the pandemic, do you think it's morally conscionable that, as a reward for all they will have done in the pandemic, that our health workers will have to pay to park outside hospitals going forward? Why not just announce, as Health Secretary, I'm waiving it. There will not be again any charges for nurses and doctors outside hospitals.
Well, there are not those charges now, and there will not be during this pandemic. Once the pandemic is over, then we will no doubt return to this question. But there is no doubt that the policy is very clear, and I haven't seen any proposal that this would have started in December in the hospital in question. They assure me that they are following the rules that I put in place, that there's no parking charges for staff. And at the same time, Piers, we're building more car parks because we need car parking spaces. Because not only for staff,
I don't
but
believe,
also
Health
for
Secretary,
patients
I
as
don't
well.
believe you think it's fair or right or proper that we charge our health workers to park outside hospitals. And I just urge you to do the right thing by these health workers. I think everyone would appreciate it. I'd also urge you to consider one more question. Dominic Cummings has been thrown out of Downing Street, not before time. I'm not going to ask you about him because I don't really care. He's gone. The damage has been done. But one of the most damaging things he did was he broke a series of lockdown rules. You publicly defended him because you had to, because everyone was told by Downing Street, you've got to go out and bat for Dom. Now that Dom's gone, would you like to rethink the tweet of support you gave him?
I'm not going to get into that. What I care about is the future. You know, the expansion of the testing, this new vaccine that we're trialling, getting people out of this so that we are back to normal as quickly as possible. And I think the Prime Minister's demonstrated this morning by following the rules, even though it's obviously inconvenient, but he'll be driving things forwards with his normal energy. That we've got to get things back to normal, and to do that, everybody needs to follow the rules.
OK, can I just ask then about the Prime Minister and which rules he's following? He met the MP, Lee Anderson, on Thursday, and he was told by Test and Trace to self-isolate on the Sunday. Lee Anderson says he first got a symptom on the Friday. Did he tell the Prime Minister?
So, as far as I understand it, Lee Anderson, who's a brilliant MP for Ashfield, he got symptoms and asked for a test on Saturday morning. He got the test within an hour or so. The results came back really quickly, in less than 24 hours. and then the testing and tracing kicked in.
So you say
and
Lee
the Prime
Anderson
Minister
got the
got a
symptoms
message,
on the
yesterday.
Saturday. Did he tell the Prime Minister on the Saturday?
He needed to get the test result back, and then the contact tracing
symptoms, you
happened.
surely
That's
should
how
tell
the
those
system
you've had
works.
contact with.
Well, you've got to go through the contact tracing system, and what happens if you get a positive test result is somebody calls you up and explains what close contact counts for these purposes and gets the contact details of those people.
So were they in close contact then? Because the Prime Minister has released a video this morning saying that they were socially distancing.
It counted as close contact, and that's what happens when it's a clinician who phones you up if you test positive and takes you through these questions of to work out who else might have been at risk, and then they get contacted. And it's an example of the contact tracing system working well.
Well, it's an
test
example,
result
actually,
coming back
of somebody
quickly,
at
then the contact tracing.
It's an example, if I may say so, of somebody at Downing Street actually trying to abide by the rules set by Downing Street, which makes a refreshing change after what Dominic Cummings did. Health Secretary, we've got to leave it there. We appreciate you coming back on the programme, and we hope it's not 6 months before we see you again.